Hello, everyone, and welcome to another episode of Living with Hep B. I'm your host, Richard So, Executive Director of SF Hep B Free. And today I'm excited to be filming this episode with a good friend of mine, Liza Gino. We have actually been working together in a Rotary project, and she has graciously volunteered to chat with us today on her experience with hepatitis B in her family. Liza is a local Rotary Club president. She is Filipina American. She is the president of the University of Philippines Alumni Association here in San Francisco. And she is actually an amazing author. So Liza, thank you so much for joining us. I would love to just hear a little bit about yourself, and then we can move on to some of the hepatitis B related things.
Hello, hi, Richard. Hi, everyone who's watching. Thank you. And by the way, I am a nine-time book award book
That's right.
award awardee,
That's right.
author. I wrote the book Imelda's Secret, and yeah, I won 3 books of book awards. And I am very involved with the community. I am, like he said, a president of the Rotary Club of Daly City Colma Evening, and I am also the president for the University of the Philippines Alumni Association in San Francisco. So I try to keep busy.
Indeed, indeed. So we can jump right in here. It would be great to hear how hepatitis B has affected your life here.
Okay, well, my mom has hepatitis B, and she ended up with liver cancer because it's been undiagnosed. So she ended up with liver cancer, and she passed about 9 months ago.
Ah, I'm sorry about that. And did she pass away directly from liver cancer from hepatitis B?
Well, she had 2 unrelated cancers. One was
Hmm.
ovarian, and one was hepatitis. I mean, one was liver cancer, and she had both of them. And she was diagnosed with liver cancer 5 years ago, and then she was diagnosed with ovarian cancer 3 years ago. So one was through Hep B, and one was an environmental cancer because this kind of cancer does not, we don't have the gene for it. So it was an environmental cancer.
I see. And in relation to the liver cancer and hepatitis B, so nobody in your family knew that she had hepatitis B. Is that
No
right?
one, no one knew. In fact, she was a bit ashamed about it. There was a whole lot of shame going on. So she kept it a secret because she said, "How can I have liver cancer? I provided that not the healthiest one out there. Why? Why cancer?" And then when the doctor told her it was because of hepatitis B, as you know, being a senior from the Philippines and being very ever so Catholic, the sheer idea that hepatitis B, she got it, has the connotation of promiscuity. So, and that's why I'm here. It's like it's not just because of that.
Yeah. Yeah, I mean, you hit it right on the head. That's something we hear a lot in the community, especially with older folks, often who are immigrants. The lack of kind of clarity on how most people, especially Asians, contract this disease. They just hear it as, oh, it's sexually transmissible, and so or transmittable. So they assume that's an the way they must have gotten it or the way everyone will think they've gotten it. So in the case of your mom, so she didn't know about her hepatitis B status before the liver cancer. She only knew once she had been diagnosed with liver cancer. Is that right?
Yes, that was the only time she realized that she was told that she had Hep B was because she had cancer and and all that. Yeah, you're right. It's like getting the diagnosis of hepatitis is like getting diagnosed for AIDS,
Hmm.
and it's just that's not just the only reason. that you can catch this. And so we need to make everyone aware. How do you get hepatitis? How do you contract it? It's not just the sex, it's a whole lot of other things.
Absolutely, absolutely. And I'm curious, once she found out, did she talk to any family members about the liver cancer and the hepatitis B, or one or the other, especially as her child? Did she talk about it? Was she really afraid to talk to you about it?
Well, a diagnosis of cancer is like getting a death sentence. So she kind of retracted to herself. She didn't want to talk to anyone. She was so moody and everything. Then when she finally talked about the cancer, we were all asking her. Then when it came to how did you get the cancer, then she retracted again. And then even some family members who don't know a lot about hepatitis, they were saying, "Don't you dare tell people that she has cancer. Don't you want you're ruining her reputation." It's like, what reputation?
Yeah. Yeah. And that's another thing too. I think a lot of Asian cultures, it's cancer. It's not like you can give you like spending time with someone with cancer, or it's their fault they got cancer. But there's such this stigma around disease in general. And I know in Chinese culture, especially in the older generations, there's this idea that like if you talk about disease a lot, it like brings bad
Back
luck,
it.
or it might bring the disease, which obviously isn't true and actually hurts everyone, because you should figure out why it is. And so did given what we know that hepatitis B is often transmitted from mother to child, does she have any siblings that she told that should be tested?
Well, again, she was terrified of letting people know. And
Mhm.
it took some coaxing to
Yeah.
to to get her to talk about it and then get people tested. Like, as soon as I found out, I immediately had myself, my sister,
Mm.
checked on my brother if they were if they were tested, and trying to tell everyone. But again, there was this like, it's my secret to tell. It
Yeah.
shouldn't even be a secret.
Yeah. And I'm assuming, fortunately, that all of her children are hepatitis B free.
Yes,
Great, great.
thankfully.
And do you know, is that likely because of that birth dose vaccination that occurs? Do you remember? I know it's a long time ago, and I'm not sure if that had become standard of practice when you were born. Do you have any idea about that?
I have no clue.
Mm.
I must say though, it's like all of us were born cesarean, so I would think that being in a hospital there would be a little, but you know,
Mm.
I can't tell for sure. That's why I told everyone, in my family to please get tested just to make sure.
Great, doing the right thing, doing the right thing. And to just out of curiosity, were you and your siblings born in the Philippines or here in the United States?
We were all born in the Philippines.
Okay, great, great. Yeah, for those of you, and that's very, very fortunate for those of you listening. Hepatitis B unfortunately remains a pretty big issue in the Philippines. I believe in 2018 there was still a study saying that in the general population it's around 10%, which is still not great. Fortunately, across the world, vaccine campaigns to make sure to test pregnant mothers for hepatitis B, and then give for those who are infected, give the infant a birth dose to prevent that transmission at birth, has been super, super successful. Many of the countries that had about 10 to 12% infection rate across their population for those born after these vaccination campaigns started in the early 90s or mid 90s is now at the 2-3% rate. For the population, maybe close to 5, but for those being born now, it's less than 1%. So the world has made significant progress. It's really now catching all these people who, like Lisa's mom, like had no idea that they might have Hep B and then are unlucky to get liver cancer. And it's very unfortunate for Lisa's mom too, because the data says about 1 in 4 who have viral hepatitis B, chronic, will develop that liver cancer. So she ended up being one of those 1 in 4, and something that we may have been able to change if she had just been screened earlier and managed. And so if I can move on, once, was there what you said, you pushed a bunch of your family members to get tested. For those in your generation, was there a pushback from getting tested as well?
No. I basically, I only had two siblings,
Hmm.
so it was pretty easy.
Hmm.
I didn't have to worry about my children because they were all born here.
Hmm.
And when we travel, like when we travel to the Philippines, first thing I ask the doctors, what do I need to get them vaccinated with? And says, oh, your kids have A and B. Um, Probably good to have Hep C also. So, it trying to manage the health of my family was very important. It's just unfortunate that it was from me down. It could have been me up, but
Yeah.
I didn't
Right.
know about this.
Right. Right. And if I may ask, how did you get involved with our organization, SF Hep B Free?
Well, again, so I know my mom was not doing well. She didn't do well with chemo. She did good with radiation, but even that was kind of taxing for her. And to see a very, very strong-willed woman reduced to less than 100 pounds, and she just wasn't herself. But so and then when I found out about the Hep B and then all the stigma and all that, I just wanted to like say, come on, people, it's not a big deal. And you can't fix the problem if you don't even know the problem. And then, through one dinner meeting at the Rotary, I chanced upon you and I said, hey, we should do something about this because we don't want to lose any more than we already have.
Yeah, and it's actually a really good example of how advocacy can happen in a very cool, organic way. As Lisa said, I was looking for outlets or inlets into the Filipino community here in the Bay Area to do more awareness. And so I attended this Rotary meeting with the idea of maybe building some connections to do some work, and met Lisa, and obviously I could feel the energy and the interest in giving back to the community. And then she approached me personally to tell me that how she was personally related to this. And so we kind of embarked on this journey. And now I am indeed part of that same Rotary Club, and we are working on a big project to try to educate, screen, and link to care a large part of the Filipino community here in the upper northern San Mateo County and San Francisco area. So it was very cool for that to happen, and we're excited to be doing that work. But back to a little bit of what we're talking about here. I think as we work to try to indeed educate the community on this, from your perspective as a Filipino American, I'd be interested to hear on what you think would be the most effective methodologies to reach your community for hepatitis B awareness.
Well, it was very, like in my experience, it was very hard to go to the seniors directly because
Mm.
again, there's this connotation that it was something done, something inappropriate was done to get it. So it'd be great to talk to the their children so that they understand that they need to convince their family, their parents, their uncles, their aunts, their grandparents that this is really a big thing that they should find out. Because again, when it's a simple test, you find out if you are, if you're not, and then you'll go get vaccinated or get treatment. Because the last thing you want is to get this into a balloon into a big headache. Well, actually, it costs your life by having cancer, which is what happened to my mother. And because it was really very hard to reach her to find out how, why, and if she was able to be, if only I got to her sooner, this may be one thing less
Yeah, absolutely. I think, man, when we talked in the last episode with David Doan and his brother passing away quite young, I think that's one of the reoccurring themes. It's like if we just got to this sooner, we have all the tools. This doesn't have to happen. I think one of the things we've stressed here on these episodes is that, like, unlike a lot of diseases where it happens and then like completely by chance, or once they get it, it's kind of all downhill. While liver cancer itself is very deadly because we can catch it while it's still in its virus form and prevent the liver cancer from developing. This is really all the Marvel movies with multi-universes, but this could be a totally different universe if we catch that screened person, as opposed to them developing that liver cancer. And so it's one of the things I'm sure that helps you, motivates you to keep doing this too.
If I may, so my mom had liver cancer. In 3 years, she got diagnosed with um, ovarian cancer, and then it was really got complicated. Instead of being able to just like operate and excise all these things, it can't because the liver cancer was already there. It was another thing to worry about, and
Mhm.
so it just limits what you have left to do.
Mhm.
And dealing with cancer is not easy on the person and the family. It it's really not just my pain, my suffering. No, it's the entire family, and sometimes it reaches to the community. Because like my mother was very active in the church, and when she passed, all her church member friends were like okay, I worry about your mom. They miss her because she's the one who always brings the food.
Yeah.
So I'm just saying
Mhm.
it's hard. For someone who has Hep B, you think it's just you. It's not. It's your kids, your siblings, and everything. I mean, it was painful for all of us to lose her, and it was, and then plus having, since I was her primary caregiver, it was hard, having to take her to take time out of my day to take her for her treatments, her radiation treatments, or, later on to her hospice care. It's painful to see someone you love, you care about, you grew up with, being so fierce to shrink into this one person that you hardly recognize.
Yeah. 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 Um, I'm wondering, did uh did you have heard of Hep B before your mom developed liver cancer, or yeah.
Well, again, when I was having my babies and
Mm-hmm.
traveling, you go through the list of
Mm-hmm.
vaccination stuff. And that's the only time I heard of it as a vaccination, but never as an actual disease and what it would do, what kind of harm it can do to a person.
And then anything ever going to your own doctor ever tell you about Hep B, or did any mention that Asians were at higher risk, anything like that?
No,
Mm.
mm, it's hard. I mean, I went through a few. I don't know about you, but it's hard to find a doctor that you could really relate to. The first three I had were, I guess that's why I went to the fourth. And then when I got to the fourth, the fourth decided to move out of state.
Mm.
So it's really hard to develop a relationship with your primary care physician. But I think that's what people think. It's, going to your doctor is not like just going for a change oil.
Mm.
People must remember that they're there. They are your primary care. It's in the word primary care physician. And unless you are able to talk to them and they can relate to you, empathize with you, then you got someone who could really champion your health needs. So if you have someone who just treats you like you're just going in for a change oil, dump that person, go get another one.
Yeah. Yeah, and I think that speaks to some of the things that we've heard from several patients and advocates. One, that cultural competency, so to make both patient and doctor feel comfortable. One, so that patients can ask about any issues. Like it's possible that well, like my doctor is Asian, so I'm more likely to say like, oh, I heard this thing that might be a thing that Asians might have. I feel like I'm more likely to talk about it with him because of that connection. And I'm sure, especially if there's some language barrier, that a doctor who can speak that same language would matter. And at the same time, too, there's exactly what you're just talking about, which is just essentially bedside manner and actually seeming to care. And unfortunately, what we've heard a lot is it may not be the doctor ignoring hepatitis B as a problem. They just haven't heard about it since medical school because, again, it affects.
I was going to say something about that because I used to be a pharmaceutical representative.
Mm-hmm.
And you're always told, do not assume that the doctor knows everything. So you're supposed to be there. But again, I guess if I ask the patient should tell them, and but yeah, I'm just saying, you're right. They may or may not remember this.
Right. And so some of the work we do, and I'm planning to do with Lisa too, is we try to go to primary care medical groups and remind them of the hepatitis B virus and the risk that it has, particularly in Asian Americans, because it is a huge part of the population here in the Bay Area. And I can totally understand if you're a physician, in Arizona, in a small town, sure, you may have learned about hepatitis B and its possible risk as an STD during the opioid crisis, which is very much true and a concern, but it is not the version of hepatitis B that is causing this distinct threat, causing one of the greatest health disparities here between Asian American immigrants and the general population. And so that's something that we go and remind physicians of, and they often say, oh, this is great. I know sometimes I hear about this, but we have so many things that we have to remember that it's good to have this reminder. Unfortunately, we feel like a lot of physicians in the Bay Area have gotten somewhat better at really remembering that if they have Asian immigrant patients to be on the lookout and test for Hep B.
I was just thinking, maybe we can partner up with a pharmaceutical rep.
Yeah.
So that the pharmaceutical rep could actually talk to them about it. They have the time because I know they set aside the time for them to talk to the lawyer. I mean to the doctor, and that's one avenue we could explore. So any pharmaceutical reps out there?
Yeah, so we actually work with a variety of companies that provide services in the hepatitis B, hepatitis, and liver cancer realm. And so we've worked with them to do educations like that before, and we do some visits, not like taking a play from or a page from their playbook, where we go meet with primary care groups and do that exact same idea with like a brochure and stuff, but not trying to sell a particular drug. But so Lisa, great thinking. We are trying to do that. And of course, during COVID, we couldn't do that as much because of the lack of being able to meet in person. So I wanted to, I have a couple more questions, but I also wanted to ask, is there anything more you wanted to add, just your thoughts on having such a close connection to the disease, things you want to tell people who might be listening, maybe particularly to a Filipino audience member, any just general thoughts?
Well, I just want to reach out to my Filipino folks out there. Mahirap ang may sakit. Mas mahirap pag may cancer. So, kailangan natin, magpatingin, magpabakuna, o kahit kausapin natin yung ating mga doktor. Sabihin natin na natatakot tayo sa, I mean, kailangan katakutan natin yung Hep B at yung cancer. I mean, we really need to be afraid of it because it impacts our lives. It impacts our families and our communities. I mean, everyone's important. So we need everyone to get tested because we need everyone around to do the work.
Yeah, well, thank you for that. I think the last thing I'll say is on that front is join us. This is an issue that you don't really need to do very much. The thing we always say is a 5-minute conversation can save a life. A single test that is free at your doctor. The screening test is almost always free. Medi-Cal, Medicare, Medicaid, and under most health insurance, because it's preventative, because they want you to do it so you don't get sick and cost the health system a ton of money. So it's gonna be free. The vaccination is almost always free as well. So this is something you can go call your doctor now, email your doctor now, text your doctor now, say, hey, I just heard about this disease. Can you check if I've been screened for it? And if I haven't, can I get screened and vaccinated at whatever the next appointment is, because the vaccination protects you for life. So then you never have to worry about developing cancer. And we could, in a generation, if everyone knew, in a couple of years, if everyone knew and everyone got screened, especially if you're an immigrant born in Asia, we could set everyone who has it into management and treatment, and everyone who doesn't vaccinated, and wipe this disease out. And one of the things I want to highlight here that I didn't mention is, if you catch the virus early before it causes any liver damage, it's a very, very manageable disease. And so it is just either one of two things. Instead of seeing your doctor once a year for your annual physical, you go in twice a year and you do a couple extra tests to make sure that your liver health is good. And if it's all good, the doctor will say, hey, everything looks great and we can move on, and I'll see you in 6 months. If it doesn't, the doctor may say, hey, I want to start you on this medication. It's a pill a day, but it has very low side effects. The vast majority of people have nothing. It doesn't affect them in any noticeable way in their daily life. And then something like 80–90% of people under management, whether that be just that twice a year visit or that pill a day or some combination of both of those, go on to live full, healthy lives. And you've heard that in some of our previous episodes. So we have all the tools to beat this disease if people just learned about it. 2/3 of people who have this chronic Hep B, most likely transmitted from their mother at birth, don't know it because they don't feel sick. As we were just talking,
Exactly.
Lisa's mom, you don't feel symptoms of hepatitis B until it becomes liver cancer. And so we can save this. I mean, we can solve this problem right now. Go out there and tell your friends, when you're at church, when you're eating at that Filipino restaurant. I know that the community is so important in Filipino culture, that you can save your friends, your relatives, your colleagues' life with this simple conversation.
Yeah, because you will look normal, feel normal until it's too late.
Yep.
So just nip it in the bud. And plus, you don't want to be living with the idea like, "Oh, I probably have it. Hey, I feel normal."
Yeah. The stress of what if, right? Like
Yeah.
why when there's a vaccine and you can get tested, like, and sometimes you used to hear way back when people were tackling HIV, they would say, I don't want to know because if I have it, it's like a death sentence, right? But that is totally not the case here. Here, you want to know
You
because you
still have
can
options.
fix it. Yeah, you still have options, and until it becomes liver cancer, when it's too late.
Yes.
Uh, Great. Well, thank you, Lisa, for your time. I want to ask, like, what are you doing these days? Right now, it's March 10th, 2022. COVID seems to be reducing. So what are you doing these days? What are you doing for fun?
Well, what I'm doing these days is that I'm helping you with this. We were able to get a grant from the Rotary Club,
Mhm.
and they approved it, and so now you will see us in churches. So for those really fun-loving religious Asians out there, you will see both me and Richard out there trying
Yeah.
to convince you and your family and your friends, your communities. We'll be there in your communities, showing you, giving you a little more information so that you can spread the word. Because this is a disease that we can conquer.
Mhm.
We can work this out. We can all learn, and we can all be better for it. So just hang in there, get tested.
Yeah, great. And I'm curious, after the success of your first book, and at the end of this, I'd love if you plugged your book. Are you thinking of writing more? I read the book and it's quite serious, and I'm wondering, are you thinking of writing again? Is it going to be something a little lighter? I
Well,
hate to put you on the spot.
my book, the title of my book is Imelda's Secret. And I think on Tuesday or Wednesday, and it's the time difference, I'm getting an award from the Philippine government. It's by the Commission on Filipinos Overseas, and it's the MAM Awards. It's the Migration Advocacy and Media Awards. So I'm receiving that. You'll see me on, it'll be live stream on Facebook. That's one of my 9 book awards. And yes, I am going to write another book. I have a few. And the good thing about, and I'm also going into speaking engagements about my book, because my book has something to do with is about the Filipina comfort women, and it is related to human trafficking, which is still very much out there. And so I will be speaking at some human trafficking conferences. So, I still have to get the date set, but once I get them, I will definitely tell everyone.
Yep. Great, great. Well, that's fantastic. And what are you most looking forward to when everyone's like officially allowed to go out and do whatever they want and gather?
Oh, well, I was at the Rotary President's Elect training seminar just last weekend. And it was so great to finally see people you haven't seen in forever, or get to
Mm.
meet new people. I think that was a plus. And so I'm hoping that we can all meet together and do things more fun. And like, what I miss is doing all the community service where you're hands on and you're there, as opposed to just watching a TV or your computer or your tablet. Feels very not connected, but we do what we can, right?
Yeah, yeah. Well, same. I'm looking forward to getting out there. We just started some community stuff, so it's been nice to see people's real faces. But
I
uh,
want to travel too.
yeah, yeah.
Real. I mean, just give me the go signal, and I'm going to go all over the world.
Yeah, sounds good. Well, congratulations on your book award. I'm looking forward to all the work we're doing. For those of you who want to learn more, please visit us online at sfhepbfree.org. You can visit our Facebook, just search sfhepbfree. As always, if you are concerned and want to get tested or screened now, you can always reach us on our website or ask your doctor. It's better to ask your doctor so that you can get all your results in the same health system. Again, it just takes 5 minutes. If you take nothing away from watching this video, just go and contact your doctor, get that peace of mind. Um, there's also, if you want a community, if you're concerned, if you have tested positive and you're facing some of that stigma and you feel alone, hepbcommunity.org is a huge online forum that hundreds of patients are talking on, so you can get information there. And of course, if you have the time and you have some of the resources, please consider donating to the work we do. It doesn't have to be our organization, but hepatitis B is one of those things that is not really talked about and is severely underfunded. And so please do consider doing that. You can do that at our website. And then the final exciting news is that if you do live in California, two major things have occurred in the hepatitis world that should make hepatitis B screening and treatment better. And that is the passage of AB 789 in the California state legislature, now mandating that physicians and healthcare providers in primary care settings offer a hepatitis B and hepatitis C screening test, so that we can catch this earlier. And that passed last November. And then the second thing is the national body that recommends vaccinations for the federal government just changed the recommendations for hepatitis B vaccination to be all of those age 18 to 59, if I am remembering correctly, which is great because it used to be the vaccination was recommended to all these at-risk categories. If you are born from one of these countries in Asia or sub-Saharan Africa, if you travel to these, if you are a drug user, if you have many partners, all these categories that made doctors have to go through this list. But now it is simply everyone age 18 to 59. So no reason, even less reason to not get vaccinated, less reason to not get screened. So that is exciting as well. Anything else you wanted to say, Lisa?
No, I think we pretty much covered it. Again, you feel free to contact, anyone, either of us. I'm more than happy to talk about this because you're right. The more we talk about it, the opportunity to save someone's life is awesome. So just talk about it.
Absolutely. Couldn't have said it better myself. So thank you everyone for joining us again for this episode of Living with Hep B. Thank you, Lisa, so much for joining me. I hope it wasn't too bad.
Oh, hey, no, I had fun. Thank you.
And we will see you all on the next one.